Picture this, it's 2 a.m. The house is quiet except for the relentless, ear-piercing wails of your newborn. You've fed them, changed them, rocked them, yet nothing works. Their tiny face is scrunched in agony, legs kicking, fists clenched, as if fighting an invisible enemy. You feel helpless, desperate, maybe even guilty. What am I doing wrong? The answer, dear exhausted parent, might be simpler than you think: colic and gas. That dreaded duo turning your sweet baby into an inconsolable bundle of distress. Want a happier, healthier family life? Hit subscribe now for science-backed secrets to better love, parenting, and self-care, delivered straight to your heart. Also tell me in comments that from where you are watching my video. Now let's start. Let's start with the brutal truth. Colic isn't just normal baby fussiness. The official definition? Crying for more than 3 hours a day, 3 days a week, for 3 weeks or more. It's like a cruel math equation no one signed up for. And gas? That's the sneaky accomplice, trapping air in your baby's tiny tummy, making them squirm, arch their back, and let out cries that could shatter glass. But why does this happen? Science has some clues. Newborn digestive systems are, frankly, under construction. Their gut microbiome is still developing, their esophageal muscles weak, and their ability to process milk, whether breast or formula, can sometimes backfire. Research from the Journal of Pediatrics suggests that colicky babies may have an imbalance in gut bacteria, particularly lower levels of lactobacillus and bifidobacterium, the good guys that aid digestion. Then there's the swallowing air theory: babies gulp down air while feeding or crying, which gets trapped, forming painful bubbles. Ever felt that bloated, I need to burp now, discomfort after a fizzy drink? That's your baby's daily reality. But here's the good news, you're not powerless. Let's talk solutions, starting with the golden rule: burping. Not just a quick pat on the back, proper, strategic burping. Studies in infant behavior and development show that frequent burping reduces gas buildup significantly. Try the over-the-shoulder hold, gently patting or rubbing their back in an upward motion. Or the sit-up technique: hold baby upright on your lap, support their chin, and lean them slightly forward while applying gentle pressure to their tummy. Some babies are stubborn burpers. If nothing comes up after a few minutes, don't force it. Move on, but stay vigilant. Then comes the magic of touch. A warm hand on a tense belly can work wonders. Infant massage isn't just a spa day fantasy, it's a science-backed soother. A study published in BMC Pediatrics found that babies who received gentle abdominal massages cried less and passed gas more easily. Here's how to do it: lay your baby on their back, warm some baby-safe oil, coconut or olive oil work, and use your fingertips to make clockwise circles around their navel. This follows the path of the colon, helping trapped gas move along. Add in the "I love you" stroke. Trace the letter I down the left side of their belly, an upside-down L across the upper abdomen, and a U from their right hip up and around. It's like spelling love into their discomfort. Now, let's address the gripe water debate. This herbal remedy has been passed down through generations, but does it work? The Archives of Disease in Childhood reports mixed results. Some babies find relief, others see no change. The key? Check the ingredients. Avoid versions with alcohol or unnecessary additives. Many pediatricians approve formulas with fennel, ginger, or chamomile, known for their anti-gas properties. But here's the catch: gripe water isn't a cure-all. It's a temporary bandage, not a solution. Always consult your doctor before using it, especially if your baby is under 1 month old. And then there's feeding posture. Imagine drinking a milkshake while lying flat. You'd swallow a ton of air, right? Babies do the same. Hold your baby at a 45-degree angle during feeds, ensuring their head is higher than their stomach. If breastfeeding, check their latch. A poor latch means more air intake. Bottle-fed babies might benefit from anti-colic bottles with venting systems designed to reduce air bubbles. A 2020 study in Clinical Pediatrics found that switching to slow-flow nipples and angled bottles decreased colic symptoms in 68% of infants. But what if the crying still won't stop? Enter the 5 S's, a life-saving framework from Dr. Harvey Karp's happiest baby on the block. Swaddling, recreating the womb's snugness. Side/stomach position, holding baby on their left side to aid digestion. Shushing, white noise mimics the whooshing sounds of the womb. Swinging, gentle rhythmic motion. And sucking, a pacifier or clean finger. These tactics activate a baby's calming reflex, a primal off switch for meltdowns. Of course, sometimes the culprit is diet, yours, if breastfeeding. Cruciferous veggies, broccoli, cabbage, dairy, caffeine, and spicy foods can sneak into your milk and irritate baby's gut. A Journal of Human Lactation study found that eliminating dairy resolved colic in 30% of breastfed infants. Try an elimination diet under medical guidance. But don't blame yourself, every baby is different. For formula-fed babies, hydrolyzed formulas, where proteins are pre-broken down, might help. The American Academy of Pediatrics notes that lactose intolerance is rare in newborns, but a milk protein allergy can mimic colic. If you suspect this, talk to your pediatrician before switching formulas. Now, the hardest truth: colic ends. Most babies outgrow it by 3 to 4 months as their digestive system matures. Until then, breathe. Tag team with your partner. Put baby down safely and walk away for 5 minutes if you're overwhelmed. You're not failing, you're surviving. And one day, those midnight screams will fade into giggles, and this chapter will be just a blurry, sleep-deprived memory.